Hi, I'm Dr. John Rush, founder of Arthritis Knee Pain Centers. Today, I'd like to talk to you about osteoarthritis. Osteoarthritis is the wear and tear arthritis. It differs from other forms of arthritis. For example, in rheumatoid arthritis, your body is attacking itself. Osteoarthritis comes from years and years of wear and tear. Often you've heard about bone-on-bone pain. You may be wondering how osteoarthritis is different from other forms of arthritis. Osteoarthritis is a chronic, indolent, progressive disease. There is no cure, but at AKPC we can certainly slow the progression of the disease, get you out of pain, and increase your mobility. Osteoarthritis affects over 30 million people in the United States and over 500 million people worldwide, and that number is growing. Osteoarthritis is often called the wear and tear arthritis, whereas other forms of arthritis are an autoimmune disease. Autoimmune diseases are usually treated with drugs, as opposed to osteoarthritis. Why does osteoarthritis hurt so bad? Have you ever broken a bone? It hurts a lot. And when people say that you're bone on bone, that is pain. Other symptoms of osteoarthritis is a decrease in mobility, along with pain that gets you really just to sit on the couch. You don't want to do anything. Usually your eating habits stay about the same and you start putting on weight. Increased weight on your knees further exacerbates that pain. Our patients at AKPC tell us that OA often feels like stiffness, pain, difficulty getting out of bed in the morning, difficulty bending. These symptoms affect your everyday living. Please don't stay in pain. Come in and see us. Osteoarthritis, or OA, is divided into 4 stages. You'll go from grade 1 to grade 2 to grade 3 to grade 4. What we want to do at AKPC is slow that progression, get you out of pain, and increase your mobility. Putting off treatment for OA will only increase your pain over time. What does that mean for you? You may lose your ability to do that favorite sport. You may lose that ability to play with your grandchildren. You may not be able to get up off of the toilet. All of these things are activities of daily life that you will lose over time. At AKPC, we see patients like this all the time. They've put off treatment, they're in pain, their eating habits stay about the same, so now they've put on weight. That increased weight causes all kinds of increased risks for diabetes, heart disease, etc. You're on a downward spiral. It also can cause depression. Patients that come into AKPC and start getting treated, now they can move again. They can go out for a walk with their spouse or their loved one. They start losing weight. It's an upward spiral. Once you know you have OA or osteoarthritis, it's imperative to get treatment as early as possible. That will help slow the progression of the disease, get you out of pain, and increase your mobility. Prevention of osteoarthritis or OA is nearly impossible. So if you do develop it, please come in and see us as early as possible. We'd like to help you live a pain-free life. At AKPC, we see this all the time. Patients coming in with osteoarthritis of the knee. They're favoring one leg versus the other, and that leads to problems in your lower back or your hip and even your ankle. The diagnosis of osteoarthritis or OA is really very simple. It is just a narrowing of the joint space that we see on a plain film x-ray. At AKPC, we have multiple treatment options for osteoarthritis or OA. Those include viscosupplementation injections. These are very heavy molecular weight substances that replaces the synovial fluid that you've lost in the arthritis process. We also have long-term steroids. We also offer platelet-rich plasma and genicular artery embolization, often called PRP or GAE for short. So if you have pain, getting out of the chair, going up or down stairs, getting out of bed in the morning, please come in and see us for a no obligation, no charge screening. At AKPC, we want to put off surgery as long as possible. And I know you want to keep your own body parts as long as possible. Sometimes it is the only option, but it is a last option. I know some of you have looked all over the internet and you see multiple options for treating your osteoarthritis or OA. How do you know which one is best for you? Please come in and see us. We are the specialists in knee osteoarthritis. We can tell you whether a corticosteroid is right for you, a viscosupplementation injection, PRP, GAE, and we can also tell you the risks and benefit of those other treatments. At Arthritis Knee Pain Centers, we specialize in the non-opioid, non-surgical treatment of your osteoarthritis, or OA. Medications can lead to addiction. Surgeries have their own complications as well as a very long recovery time. We like to think of that as a very last option. For the vast majority of patients, at AKPC, we can treat you without the use of medications or surgery. Our patients at Arthritis Knee Pain Centers often feel almost immediate relief, and there is no long-term recovery. So please, if you're in pain, go to our website or call the number on your screen and schedule your no obligation, no charge screening. It's time. You've put off your knee pain for far too long. Please come in and get the relief you deserve. Take the first step toward a more comfortable life.